Hello friends, welcome to my YouTube channel MSN by Asif. Today I am happy to announce you that I am going to be start my dream topic, series of nursing competency. Yes, series of nursing competency. So basically it's a series, so it's a different parts that is going to be deal with the nursing competency. So this was my dream topic I want to discuss when I was in the teaching field. Currently I am in the clinical area. So priorly I was a teacher, and at that time I decided to discuss these nursing competencies. But that time I was not did it. But today I meet my ex-students in one function, college function. And then I discussed with them. They came and they asked me. They told me, sir, we discussed the medical surgical nursing and we go to the clinical area, and what we studied and what we are observing is completely different. So I told them it's not different. The aspect you are going to be see to the patient is different. Then they asked me what it means, sir. So I told them that is one challenge you given to me, and I will create one video and I will post. So I meet my second year students, I meet my fourth year students. They also told me, sir, give me a tips how we are going to become a confident, how we are going to become a competent. And I told them I will try my best, and I came to the home. And then the challenges begin for me, and I find the ways that we can become a competent nurse. We can become a competent nursing student. Okay, so you can give me a suggestion in the chat box because I am updating the content. Okay, so I am talking about the nursing competencies. So when I am going to talk about the nursing competencies, what I want to say, I want to give in the example. Okay, so basically you are in the emergency department. I always given the examples as the emergency department because I am an emergency nurse, so always this type of the thoughts came in my mind. So consider you are in the emergency department and the patient came with a complaint of breathlessness. So oxygen vital signs checked, oxygen level seen between the 94-95, patient having the breathing difficulty. Then we give the treatment is started. We taken the patient on the bed, IV cannulation done, injection hydrocod given, neb with deolin given, and as an outcome the breathing difficulty decreased. Oxygen saturation improved, and at the same time the other patient came with the same complaint of breathlessness. And then what will be occurs? We given the same treatment and the breathing difficulty increased. So what difference between this and this that we are going to be discussing in this series? Okay, so we will go back one step. When the patient came to the emergency department, the patient having the breathlessness over here, and we take the history. Patient having the complaint history of COPD, patient having the crackle sounds, wheezing sounds, and then because of that we given this treatment hydrocod as a steroid anti-inflammatory. Deolin contain two component, that is the salbutamol and ipratropium bromide. Salbutamol is going to be help in the dilation of your airway, and the ipratropium bromide is going to be decrease the secretions. So this treatment is okay, correct for this patient. The other patient which came, we are going to be asked the history now. Okay, so we ask about the past, what are the complaint patient having the breathlessness. So then we ask about the past history. Do you have diabetes? Do you have the hypertension? Do you have any heart problem? Then he told, I am having the heart problem. So patient having the heart disease. So when patient is telling he is having the heart disease, then our mind has to be diverted to the two areas. One is a respiratory, one is a cardiac. So here we have to be seeing both the areas. Now we are going to be asked the next questions, whether you having the cough. Patient is told yes, I am having the cough. Then the next question, as a cardiac direction, I asked, any blood tinctures find out in the cough? Then he told yes, the cough, blood is there with the cough. So patient having the blood tinctures in the cough. Then the next, do you did your any lab investigations, echo? Yes, and we find the EF is 35%. So when we are going to be seeing these areas, patient having the heart disease, patient having the cough which contain the blood tinctures, patient having the previous heart problems, EF is 35%. What is the EF? EF is a systolic volume divided by end diastolic volume. So basically, when the heart is pumped, at that time how much amount of blood is there, and when the heart is relaxed, how much amount of blood is there, their ratio is called as a EF. If the EF is less, patient having the heart problem, then what will be occur? Okay, so when the EF is less, then what will be occur? There will be a more pressure in the left ventricle chamber, in the ventricle chamber. There will be a more pressure in the ventricle chamber. Then what will be occur? Automatically the pressure will be increased in the left atrium. Pressure is more in the left ventricle because of less EF. Pressure will be increased in the left atrium. See, the amount, there are mainly two types of the HF, heart failure, type 1 and type 2. So one is a concentric and one is a dilated. When we are going to say the concentric, the internal diameter will be less. And when we are going to say about the dilated cardiomyopathies, basically the heart chamber is dilated, more amount is there for the blood, but it not able to contract, because of that the blood will be stays there. So in the both cases, the area is less or the blood is stays over there. In the both cases, what will be occur? There will be increase the pressure, because already the blood is there or the area is less. The blood which is going to be come here will be create the pressure in the left ventricle. Now left ventricle is full, pressurized, automatically the backflow pressure will be increased in the left atrium. So the pressure will be increased in the left atrium. So if the pressure is going to be increased in the left atrium, automatically the pressure will be increased in the pulmonary area, pulmonary vein. So this pressure is called as hydrostatic pressure, and because of that what will be occur? The fluid will be shifted out to the interstitial area and we call as a pulmonary edema. Okay. So here the complaint is breathlessness. Then the next thing is patient having the heart problem. In the history we find out the patient having the heart disease. The third thing, that patient having the cough with the blood stains, blood tinctures. Then next thing, in the auscultation we find the fine crackles. So these all findings is going to be tell you this is not respiratory problem, this is the more likely the cardiac problem, that is a pulmonary edema because of cardiac problem instead of that COPD. See, when you are going to be see the patient in a different aspects, you will understood that the problem is different. So the treatment went different. It's not that you studied a different and you are finding a different. It's basically the view you are going to be see to the patient. So if you are going to be see here the patient having the same breathlessness here, patient having the same breathlessness over there. But when you are going to be asked the history, in the history patient told that patient having the heart disease. The patient told that patient having the coughing. And when you ask about the heart disease, you ask your next question whether the blood is there in the sputum. He told yes. Then the more likely it's going to the pulmonary edema instead of COPDs. then you auscultate, you find the fine crackles, and this all things is going to be tell you as a patient having the heart problem which is causes a pulmonary edema. It's not like a COPD or other respiratory problems. In more, if you find the patient is on the treatment like a Lasix in the history, then also it's going to be tell it's like more likely that patient having the cardiac problem which is going to be create the pulmonary issues. So here we given the same treatment, hydrocod we given the name. Okay, so we given the hydrocod, okay, then we given the name. I told the name we had two components, one is the salbutamol and second is the ipratropium bromide. So ipratropium bromide is an anticholinergic, it is going to be decrease the secretion, but as a complication it's going to be increase the heart rate. So if the heart rate is going to be increased in this condition, what will be occur? The pressure will be increased in the pulmonary area much more, and then what will be occur? That the same happening here, breathing difficulty increased. See, the same complaint patient having the breathlessness, and the treatment is completely changed. So here the treatment main likely a Lasix. So that is going to be decrease the pressure in the pulmonary area and decrease the fluid in the body, and then automatically the pressure will be subside. So here the treatment went different. Here the treatment went different, and you are going to be say that we studied a different and we finding a different. It's not that you studied a different, you finding a different. It's basically the history, the patient's complaint, the lab values, and your disease conditions. That all if you are able to be correlate, then you will be understood this. Okay, so basically here it's not like that you not studied. You studied the pulmonary edema, you studied the COPD, but when you enter to the clinical area, you find the same complaint and you find the different treatment. It doesn't mean that you not studied that. You studied both the diseases, you studied, but the view of you are going to be see to the patient is completely different. And how you are going to be viewed, how you are going to be approached to the patient, your next question will be depend of your previous question. Like here, I asked the patient having any heart disease, patient says yes. My next question is changed, that whether the blood is present in the curve, because I correlate my first question with the second question and I goes to that flow, and then I reach that patient having the pulmonary edema instead of COPD, and because of that the treatment is changed. So you know the disease condition. The problem is the view, the problem is the assessment, the problem is the history, the problem is the lab values correlations, the problem is the correlating your complaints with the lab values, complaint with the physical examination. If you are able to correlate all these things, it will be not difficult to become a critical thinker and to become a clinical competent nurse. Okay, so I want to give one more example to clarify my topic. Okay, so one more patient came with a complaint of abdominal pain. Okay, so when the patient came with the complaint of abdominal pain, abdomen is a completely whole one. So you have to be start to specify. So how you are going to be start to specify? You know the quadrant, then you ask the patient, can you touch your abdomen and tell where is the exact pain? Then he touched the epigastric area. I write, the pain is at epigastric area. Then the next thing came in my mind, that in the epigastric area I have mainly two organs. One is the stomach and second is a part of the pancreas. So my second question will be depend on that, whether the pain is a burning. Patient say no, pain is a sharp. So one point is clear, it's not a acidity, it's not a gastritis. Now the second thing, sharp pain is there. That could be a pancreatitis, that could be a peptic ulcer. My next question, whether the pain relieve after food and increase between the meals. So basically what I want to say, that if you are going to be eat the food, the acid level is going to be subsidized and pain is going to be decreased, it more likely a peptic ulcer. But if patient denies, patient didn't told that the pain is going to be relieved after the food, then my concepts is going to be goes to the pancreatic areas. Now I receive this patient, I take the patient, I do the cannulation, IV cannulation done, and then what I did, I started the treatment, pain management. So I started the pain management. My mind is going to be stuck on the lab values now, because your lab values is going to be tell whether it is a pancreatitis or not. So we send the serum amylase. So what is basically a serum amylase? Serum amylase is an enzyme. What is the enzyme? Enzymes are present in the organs. And when the organ is going to be damaged, when the organ is going to be infected, when the organ is going to be inflamed, it's going to be released in the blood. If amylase will be increased in the blood, it means there will be a damage to the pancreas. There will be inflammation to the pancreas. Then what will be occur? I did the cannulation, I did the pain management of the patient, and then the pain subsidized. At the same time, I sent the lab investigation, including the CBC. CBC is going to be basically tell about any infection, because we are going to find out the WBC count. And then serum amylase level came as high. And when the serum amylase level is going to become as high, my point of view, whether it is a gastric pain or whether it is a pancreatic pain, is going to be subsidized. And now I clear that patient having the pancreatitis. See how you are going to be correlate. So you have to be correlate the patient findings. You have to be correlate the assessment findings, and then you have to be correlate your assessment finding with the lab investigation. So here I just tell in the general concept. I didn't go in the deep examination, because here we are going to do the palpations, and in the palpation we are going to be touch each area in the light palpation, and we are going to be see each quadrant. And when we are going to be touch the epigastric area, patient will say, yeah, pain is increased. So that is also part of the physical examination. So we are going to be find out the history. We are going to be did the physical examination. As I said, my previous question will be depend on the next question. So we goes in the direction of the questions depending on the previous questions, and then we reach, it is not a gastric problem, it should be a pancreatic problem, and that we are going to find out in the serum amylase. And we send the sample, and the amylase level increased, and the doctor diagnosed the patient as a pancreatitis. So the treatment will be goes on as antibiotic, pain management, and other as the on flow. So basically what I want to say, how you are going to become a nursing competence, how you are going to be a competent nurse, clinically competent nurse, is completely depend on correlating your theory knowledge with the clinical aspects. So as I told priorly, it's not that you not studied, you studied the disease conditions, but when the patient came to the department, when the patient came to the hospital, he came with the complex type of the complaints, and you have to be find out by the assessment, by the examination, by the previous history, by the lab values. Then these all things will gives you a clear picture what type of the problems patient is having and what treatment patient is receiving. At that time you will be not get confused that I studied one disease and when I see the patient the treatment is completely different. That time you will be clear that you know that disease, you know that patient, and you find out all the things, and at that time you know that what are the complaints patient is having, what are the assessment findings patient having, what are the physical examination finding you find, and what are the lab values patients having. And once you correlate all things, your picture will be a clear what problems patient is having, what treatment he is taking. At that time you will be not get confused. Okay, so how we are going to be achieve these clinical competencies? So I find out the solutions. That is the first is the introductory session that I am doing. The next assessment and physical examination. Basically I can't show complete examination, but I will try my best to visualize in the picture form. Then next, at the same time we are going to be discuss the clinical conditions to understand more better about the physical examination as a clinical competency, then the lab value interpretation system wise, then the radiology interpretations, and at the end ECG including the arrhythmias and its treatment. So that is my plan to achieve the nursing clinical competency. As I am updating the content, you can give your suggestion in the chat box. So if you feel that we have to be add in the content, we will add and update the content. So basically that is my plan, that how we are going to be achieve the nursing clinical competencies. So please give your suggestions and subscribe my channel to the notification for my next session, that is assessment and physical examination. Thank you so much.